Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders in Parliament for the welfare of the society and the just government of the people, we beseech you to behold with your abundant favor us, your servants, whom you have been pleased to call to the performance of important trust in this republic. Let your blessings descend upon us here assembled, and grant that we consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country, and of those whose interest you have committed to our charge. Amen. Next order.
Order number 1, administration of all.
Next order.
Order number 2, communication from the chair.
No communication. Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
No petitions. Next order.
Order number 5, papers.
No papers. Next order.
Order number 6, notices of motion.
Next order.
Order number 7, statements.
We have a statement. We have response to statement. We have a response from the Chair, Water and Environment, Honorable Rose.
I'm Rose Chepkoech, MCA Kiptakich Ward. Honorable Speaker, on 1st August 2023, Honorable Robert Ruta from Kapukures Ward requested the chairperson on Committee, Energy, Environment and Water on Natural Resources concerning Lalwet Mogon Water Piping Project, which was redirected to Ingobor Water Project. This project has been awarded 1.5 on 2022-2023 budget. The amount was to be used in piping of the same, but was changed to supply water pipes to Ingobor Water Project. Honorable Speaker, upon receipt of statement on Committee of Energy, Environment and Water, wrote to the Department of Energy, Water and Natural Resources to respond the following issues. 1. Whether the CEC is aware that Lalwet Mogon Water Piping Project was redirected to Ingobor Water Project. 2. How the county government will recover the money spent on 26 pipes that was supplied and used in Ingobor that was not budgeted. 3. The measures the department has put in place to curb such mixed-up in future in terms of identification, implementation of projects adhere to approved budget. 4. Why the project description was changed to supply instead of piping. Measures that 5. Measures the department has put in place to ensure the project is completed within minimum time possible. Honorable Speaker, in department response, they stated that they are aware of the concern, the proposed supply of pipes fitting of Lalwet Mogon Power Hole. In Kapukures Ward, Nakuru West Sub-County, in which it's amounted to 1.424,387. They also stated that the above project was implemented during the financial year 2022-2023 at the total of 1.424,387 to supply water in needy areas of Magon, Lalwet of Kapukures Ward. And the project is serving areas of Lower Lalwet and Magon area, which is a source of water in Ingobor Water Project. 2. That is because the project main distribution tank was relatively at higher ground, and hence the water can gravitate the areas of Mogon, Lalwet, After the tender was awarded, the pipes were delivered to the official of Ingobor Water Project so that they could mobilize the community to carry out trench excavation as planned. They also stated that 26 pipes were laid in trench and serving as highly advocated, and that the hope of features of the department delivering the pipes to Ingobor Water Project does not mean that they redirected to the project because the area has been earmarked to supply for this project as other projects nearby which were operational by then. 3. It was not that Ingobor Water Project could fairly serve first areas upon Magon lower side of Laluet, and hence reason the project was allocated more number of pipes. The remaining 8 pipes were shared with Kamnanda, that also lower area of Magon, and upon Laluet through piping. 4. Monies that were utilized have benefited the area of Laluet and Magon as highly planned during preparation of Bill of Quality, that is the PQ. It was agreed that Ingobor Water Project should serve the area of Laluet, Magon. Consequently, after the project was awarded, pipes were delivered to the Ingobor Water Project that was aware of intended activities that quickly proceed to link. 5. That the department strongly believed that there was no mix-up whatsoever because the project description in the budget was very clear that the water piping was to be done across Laluet, Magon power holes. This means that any area within the 2 named power holes could be considered in order to serve the areas. Reliable source of water has to be identified by BQ preparation. In our case, water was sourced from Ingobor Water Project. 6. The word piping means to carry out reticulation of water in the area by use of pipes. The department achieved this by supplying pipes and installation of the same in trench for their case. The pipes were delivered. Community contributed towards trench excavation. Through this was additional area of coverage as a result of the beneficiary and skilled labor contribution through trench excavation. 7. That in this case where the existing pipes were inadequate and there was need to extend the pipes network to unserved area to increase coverage, they plan to use funds from the project title drilling piping of Laluet power hole in Kapkures Ward 2021-2022 with allocation of 2,075,391. However, these project funds were reallocated during supplementary 2023-2024 on April. Therefore, in addition, funds were required to increase coverage at the needy areas. Thank you, Mr. Speaker, sir.
Thank you. Honorable Member for Kapkures, you should be digesting the response. As we get another response to statement, I'll give you a chance to comment on the response. We have another response to statement from Chair Implementation, Honorable John Mwangi.
Thank you, Mr. Speaker, sir. I'm John Mwangi, the Chair Implementation Committee, as well as the MC for Tuli in Molo. I am here to give the response in a statement requested by the member for Naivasha East. Honorable Speaker, during a plenary sitting held on Wednesday, 18th October 2023, Honorable Stanley Karanja sought for a statement from the chairperson on the Committee on Implementation. In the request, the member sought for response on the following. Number 1, how much was allocated for the fence and the current implementation status? The contractor that was awarded the project. Number 3, how much has been paid to the contractor to date? Number 4, measure and timeliness on the respective county department. The respective county department has put in place to ensure the project is completed. Honorable Speaker, the committee wrote to the CCM Trade requesting for a detailed response on the following. Number one, the project was budgeted in the financial year 2020-2021. Number two, the contract number NCG/ONT/TITC/783/2020-2021. Number three, the contractor name was MS Shefana Limited, and a copy of the company certificate was attached. Number four, the project commenced on 8 September 2021. Number five, the project cost in total was 9,658,590,000. Amount paid was 6,026,905, and the payment voucher released by the Public Works on 25th May 2022. A copy of the voucher indicating when the first payment of Kenya shillings 6,026,905 to the contractor was also submitted. The balance, which was not settled, was 3,600,031,685 shillings. A copy of the minute of the Project Management Committee was also submitted. There exists a beacon dispute that resulted in disparity in acreage of 0.021 hectare. The contractor did the work up to mid-September 2023. Thereafter, the work slowed to a halt. Next, delay by the county government in solving the beacon issue led the contractor to redirect the funds to other uses. Hence, the department is sourcing for other resources to complete the project. Further to this, the CCM appeared before the Committee of Implementation on 19th June 2024 and highlighted the following: that the entire Karai Fish Market project was started by the second county government. The project was to be done by the county government in partnership with East Africa Grain Council. The estimate cost was 239,885,701 million, but the first phase was estimated to be at Kenya shillings 80 million. He, however, noted that the contractor deserted the site due to an existing beacon dispute, but the department is still in negotiation with him to resume the project. Honorable Speaker, to this end, I hope the member who requested the statement, that is Honorable Stanley Karanja, is duly answered. Thank you, Mr. Speaker.
Thank you so much. Do you have the members who requested for statement in the House to give their comments? It's good for us to be coordinating that when we are bringing the statements, also the honorable members who requested be available so that we can ensure it has been given satisfactorily. We also have requests for statement. We have a request for statement from Honorable Rose Gadoni. Honorable Ruto, I'm informed he's within the House. All right, let's proceed.
Thank you, Mr. Speaker. Honorable Speaker, pursuant to Standing Order number 47, 2C, I rise to request a statement from the Chairperson of the Committee of Labour, Gender, Youth and Social Welfare concerning the street families menace in the county. Honorable Speaker, we appreciate those street children, youth and families phenomenon is one of the major socio-economic challenges facing Kenya. The steady growth of street population over the years has been due to various factors, including rapid growth of national population, extreme poverty, and rural-urban migration, among others, including the introduction of JCC, Mr. Speaker, it has brought about increase of children's rates on the ground. Honorable Speaker, while this phenomenon is a reality that we must face, it should not be lost on us that the Constitution under the Chapter 4 guarantees every person economic and social rights, including rights to accessible housing, education, and medical treatment, among others. It is disheartening to witness young children who should be in school living under extremely poor conditions in major towns in Nakuru, despite the express provisions of the Constitution on the inalienable rights. Honorable Speaker, urban centers population in Nakuru is growing rapidly. As such, there is need for the county government to have comprehensive plan to address social problems that comes with urban population growth. I am aware this House appropriated funds each financial year towards the social welfare programs. I therefore request the chairperson of the Committee of Labor on Labor, Gender, Youth and Social Welfare to respond to the following. 1. Which programs has the department concerned put in place to address the ever-growing street families challenge in major urban centers, including Nakuru CBD, Naivasha, Gilgil, and Molo, among other centers? 2. Has the county government entered into any partnership stroke collaborations with the national government and all the development partners to supplement the county government intervention? If yes, what are the outcomes of such partnership? Thank you, Mr. Speaker.
Thank you, Mheshimiwa. I wish to commit that request to the Committee on Labor, Gender, Youth and Social Welfare. Do you have any member of the committee in the House to take note? See, we don't have the chain. Take note, we committed to that committee. We have another statement that is being requested by Honorable Wathiai Macharia.
Thank you, Mr. Speaker. Mr. Speaker, sir, pursuant to the Standing Order number 47, 2C, I rise to request for a statement from the Chairperson, Committee of Health Services, concerning the status of the standby generator and lack of power at the Margaret Kenyatta Mother and Baby Wing. Mr. Speaker, sir, aware that the decentralization of services is one of the objects of devolution, operationalization of health services is key in realization of this objective. Mr. Speaker, further to this, healthcare services provision cannot be achieved if essential services such as electricity is not continuously enhanced. Mr. Speaker, sir, in the recent days, frequent loss of power and rationing has been a normal norm. Hospitals have not been spared, hence affected key service provisions such as the newborn unit, which requires continuous electricity supply. Mr. Speaker, sir, concerned that the Margaret Kenyatta Mother and Baby Wing standby generator is not in good condition, mortality rate might go up due to the disrupted electricity supply, which has affected newborn unit services. This can have a negative effect to mothers and families affected, Mr. Speaker. Mr. Speaker, concerned that the mothers are not guaranteed of enhanced NBU services at the facility due to an unfunctional standby generator, I wish to request the Chairperson, Committee on Health Services, to issue a comprehensive statement on the following. Whether the Department of Health Services is aware that Margaret Kenyatta Mother and Baby Wing has a dysfunctional standby generator, and the mitigation measures the county government has put in place to restore the standby generator to curb such further increase in mortality rate at the facility. Thank you, Mr. Speaker.
Thank you so much. The Chairperson for Health Committee, I see you in the House. I wish to commit that request to the Health Committee.
Mr. Speaker, perhaps you should give us the the timelines so that we be preparing the responses.
Thank you so much, Madam Chair. It was my oversight. That would be 2 weeks. The same would go for the one we committed to labor and gender within 2 weeks. Honorable Paul Warege, you have a statement to request.
Thank you, Mr. Speaker. My name is Paul Waweru Warege, Area MCA for Kemaina Ward. Honorable Speaker, pursuant to Standing Order number 47, subsection 2C, I hereby request for a statement from the Chairperson of the Sectorial Committee on Implementation Status of the Sports Kitty for the financial year 2023-2024. Honorable Speaker, the county government allocated Kenya shillings 27.5 million monies for sports kitty in the budget for the financial year 2023-2024. This was cascaded down to Kenya shillings 500,000 per ward for the 55 wards across the county. In review of this, each ward, through the respective members of the county assembly, forwarded a list to the department on the items, stock equipment, to be supplied. Honorable Speaker, while acknowledging the efforts of the Department of Sports in implementing the sports kitty, the quality of some items, stock equipment, did not meet the best standard stock quality. This has consequently compromised the objective of the kitty since the value for money is not achieved. Honorable Speaker, the sports uniform stock equipment supplied in various wards is of poor quality. Honorable Speaker, it's on this note that I seek for a detailed report from the Chairperson Committee Implementation outlining the procurement process of the sport equipment as follows. 1, the list and cost of each sports equipment stroke item distributed per ward. 2, the cost of branding of each item stock equipment and the sum total per ward. 3, cost of delivery of the equipment per ward. And finally, 4, list of supplier or suppliers of the above items. I beg to request for the statement. Thank you, Mr. Speaker.
Thank you very much. The statement, as requested, we committed to the Committee on Implementation. I see the chairs around. Kindly. All right. We're giving you 2 weeks to bring back a response. We have another statement being requested by Honorable Rose Kadoni.
Thank you, Mr. Speaker. Pursuant to Standing Order 47 2C, I hereby request for a statement from the Chairperson of the Sectorial Committee on Trade, Tourism, Cooperative and Planning concerning insecurity in Gilgil Ward Market. Honorable Speaker, whereas the Constitution, the core mandate of the county is development, several roles with security implications which have been devolved to the county governments. The control and regulation of access into markets by unauthorized persons, hence posing danger and theft of goods, animals straying into the market and destroying goods and properties, have an indirect but nonetheless important implications and impact on security. The current insecurity in Gilgil market is posing danger to the traders, and urgent measures should be undertaken to ensure our markets remain safe and secure while carrying out businesses. It is in this matter that, Mr. Speaker, I would like to bring to attention that a trader's watermelon were destroyed. That is, they were cut into pieces worth 100,000 shillings, which is so unfortunate. Honorable Speaker, it's on this note that I seek to request for a statement from the Chairperson Committee on Security on the status of insecurity at Gilgil Market due to worn-out fence. The plans the county government is undertaking to repair the market fence. Measures the department has put in place to curb insecurity cases in Gilgil Market. Thank you, Mr. Speaker.
A statement goes to Trade, Tourism and Cooperative Planning Committee. If you remember, kindly take note. Also, we give it 2 weeks. This time I would wish to request that we coordinate. When we are bringing back the response, let the people who asked for the statements be in the house so that we can make sure we deal with the matter definitively. I also wish to direct that for the statements that we are given, let's make sure that those who requested have been furnished with the statements. Next order.
Order number 8, motion.
We have a motion by Honorable Njogona.
Thank you, Mr. Speaker. Mr. Speaker, I rise to move a motion on Londa Hospital, that is Londa Health Center. Mr. Speaker, the Committee on Health Services went to Londa Health Center in Kaptembo Ward on 24th of October 2023 to seek, or rather to know, the way services have been offered into that facility, and even the status of that facility, and also to know what the responses from the members of the public and how they view the services that are offered to that facility. Mr. Speaker, allow me to go directly to the objective of the visit, which was to assess the status of the health facility, to ascertain on quality of health services offered to the members of the public, to highlight the achievements of the hospital, challenges and areas of improvement in service delivery. The background information on the said facility. Londa Health Center is a community-based health facility located at Londa area of Kaptembo Ward in Nakuru West Sub-County in Nakuru County. It covers approximately 1 acre of land, which was set aside by the community of Ronda with the help of local leadership for purpose of local development. The facility was constructed in 2010. The health center serves a catchment population of 18,186. It is worth noting that Londa Maternity Wing was constructed with the help of Ronda community and the county government of Nakuru, coupled with other stakeholders. The facility has no title deed, and this has been an issue that the community has been pursuing to acquire the title deed to the date. The facility was operationalized in 2012. The maternity wing was officially opened by Honorable Samuel Alama, who was the Member of Parliament for Nakuru Town West. The outpatient unit was constructed by the county government of Nakuru and was officially opened in 2014
by His Excellency Kinuthia Mbogwa, the first governor of Nakuru County. It is worth noting that the LMCA has been allocating resources to facilitate through the Department of Health Services to have a facelift in the facility. The facility approximately serves 6,000 patients monthly. Services provided and the number of patients served at the center. The health center operates 24 hours per day. It has a 24-hour maternity service and outpatient unit. It also offers the Child Welfare Clinic, that is CWC, Comprehensive Care Clinics, CCC, laboratory services, TB services, primary health care, gender-based violence services, youth-friendly services, curatives, HIV/AIDS services, among others. The staffing at the pictorial level, Bwana Speaker, there is a pictorial level, pictorial for the said facility, which I'm proud because at the rate at which that facility is being constructed and the kind of the infrastructure that we found in that facility was actually, it was actually a good move. And it was one of the facilities that I can say that was started just recently. But the kind of the development that we saw there, the ward itself and the members of the public together with the LMCA, they are doing quite well, and they require actually acknowledgement because of the kind of development that we saw there. Just recently we were having Naiswit and other areas that we had dispensary that was started in 1950s. But the levels that they are in currently, they are not doing well. But these ones, they have concentrated all their resources there, and they have done quite well. There is a staff establishment of 32, as outlined there. Members can just go through. Mr. Speaker, when we went there, we started with the triaging area, and it is actually, we have the pictorial evident to show that. They also have some injection rooms that they are very well, they're spacious, and they have a very clean facility. They have also the registration and where even the records are kept, and they are still spacious, despite that that facility is constructed on 1 acre. They have pharmacy. By then there were drugs. I don't know whether there are still drugs. And I request, Mr. Speaker, that the respective members to be frequent visitors of these facilities, to be checking whether there are drugs. And if there are no drugs, Mr. Speaker, they can also be sorting for statements, and at least we can put the department on its toes to making sure that there are drugs in those facilities. Mr. Speaker, they also have rink room. These were HIV/AIDS patients seek services. The nurse in charge noted that stigma in the surrounding areas is quite high, making patients shy away from getting services from the facility. It's worth noting that. They also have modern laboratory, which is well equipped, and it has lab technicians. They also have labor ward, and at the time of visit there was no patients. So I wish the Honorable Kajwang was here, because you need to tell us what the youth there are doing, because if there were no patients, and in that week they had not recorded any patients for that purpose, or there were no patients at that time, that week, then it means that there is something that is happening, and of which it's worth noting that the members of the public ought to actually to be emphasized onto that, and also the youthful generation in this house, Mr. Speaker. Mr. Speaker, allow me to go to the achievements that they have made over the years. Number one, the Londa Health Center is highly attached with medical students from various institutions to gain knowledge. The health facility providers offer quality healthcare services to the community. The location of Roda Health Center allows accessibility of health services to the community. Mr. Speaker, this facility is located at Kaptemba, and you know Kaptemba was just recently upgraded. It was termed as an informal settlement, which qualified it in the past to be a slum, but currently the population and the catchment, it is centrally located, therefore it is accessible to the members of the public in that ward and the neighboring ward, that is Londa and also Shabab. There is availability of community units that offer preventive and promotive healthcare services in conjunction with community health promoters, thus providing primary healthcare services. The facility has been able to meet other psychosocial needs of the community, including people living with HIV, people able differently, and other vulnerable groups of people. There is an ongoing construction in the facility under the leadership of the area MCA in conjunction with the county government of Nakuru. The facility has a gender-based violence recovery center and youth-friendly center. Mr. Speaker, allow me to note that this is the only facility that I have seen that socially it's supporting the members of the public. For instance, there was father clinics days, and the fathers were around to come with their women, with their wives, to take their children to clinics. I think that one is one of the facilities that is distributing the gender responsibility even to men, whereby the fathers are accompanying the mothers, and to some extent, even they are taught how even to feed the kids. You know, some of us, because of the patriarchy and the patronage of the African tradition, it's rare that we can be able even to be left to nurse the kids. But in that community, fathers are allowed and they are taught how even to take care of the kids, and that is one of the best things that I found in that facility. There are also the issues of gender-based violence. Based on that informal settlement that place was, there are rampant cases of gender-based violence, and they have come up with a unit or a program whereby the victims can be able to be nursed, and there are no those actual teething issues of the issues to do with even with P3 and such kind of things. They have well-structured programs whereby these people are taken care of. Also, Mr. Speaker, there was a youth-friendly center that is in that area, and that one is taking care of youths. And you know that the youths are affected by economic challenges and other challenges, drug abuse and such kind of things. So they have a youth-friendly center that is supporting the youths, and this is encouraging, and it is according to the adherence of the bill or an act of this house, and how I wish other facilities can follow the suit, and even the members in this house can encourage the management, the board of management of those facilities, to come up with such kind of projects so that we can be able to sort the social challenges and social problems that we're having in our societies. Committee observations. The committee made the following observations and findings during the visit. That the hospital has no title deed. Mr. Speaker, I don't know which day that we are going to one of the facility, and we find that those facilities has title deeds. Mr. Speaker, why it not even for construction of these infrastructures, or that is structures in that facility, probably we could be dealing with the issues of encroachment. Therefore, Mr. Speaker, it is good, and it's worth noting that the Committee on Land ought to still pester this matter further and ensure that these facilities have the title deed as required or as requested by the members of the public that we found in that facility. There is acute shortage of staff in the facility. Mr. Speaker, this is another rampant challenge, and in each and every report that we have tabled here, we have noticed that the number of staff that are serving in our facility, it's wanting, and therefore we request this house to do something as far as that is concerned, and I'm seeing the chair budget is here. We really need to do something as far as the staffing levels of our facilities, because I don't believe that those people are giving proper services because of actually of the number and the population that is growing. Therefore, something ought to be done. The facility do not have a washing machine for roundry purposes. The facility has no operational theatre, thus making the labor ward underutilized. Mr. Speaker, as I said, we do not find any patient or rather a mother who was actually giving birth during that day. And therefore, maybe because there were no labor, even minor surgeries cannot be conducted or cannot be done into that facility or cannot be done in that facility. Therefore, how we wish that the county government of Nakuru will do something about that, the labor, that is theatre, so that at least more patients, more mothers can go to that facility. The facility should be elevated to a level 4 hospital. With the kind of the population that they are serving, and the kind of the catchment that facility is located, that is urgently needed. Recommendations of the committee. That the county government of Nakuru should facilitate the issuance of title deeds to the facility. I had mentioned that area. That the Department of Health Services should allocate more resources for recruitment of staff in the facility and other facilities. That the Department of Health Services should prioritize purchase of washing machine for roundry purposes. That the county government of Nakuru should construct and operationalize the modern theatre for optimum functionality of the said facility. That the Department of Health Services to elevate Londa Health Center in Kaptembo Ward to a level 4 hospital. Mr. Speaker, were it not for this lack of theatre in that facility, I can tell you that is a level 4. Even via the catchment, the population that is being served there, the number of services, or rather the services that they are offering, they qualify. And therefore, we request that during this financial year or in the next financial year, if they can construct a theatre, we can highly request, and we are requesting the department to elevate that facility so that it can continue serving the members of the public in Kaptembo, Ronda, and also Shabab Ward, so that they can have proper services rather than actually referring cases to the PGH. Therefore, Mr. Speaker, I beg to request this House to pass this motion or to support this motion so that we can see whether the executive are going to implement this report to the letter. I wish to request the Honourable Chair for the Budget to second.
Thank you, Mr. Speaker. Mr. Speaker, I wish to stand and second this motion, and wish to stop it at that so that I can contribute in the main debate. Thank you.
I now propose the question that this House adopts the report of the Committee on Health Services on the visit to Ronda Health Center in Kaptembo Ward held on 24th October 2023. The motion is open for debate. Honorable Member for Menengai.
Thank you, Mr. Speaker. I rise to support the motion. Mr. Speaker, I've really listened to the chair giving out the comments on the Ronda report. And Mr. Speaker, having this area very highly populated, of which we can have so many contagious diseases that members of the public can get because of the high population, Mr. Speaker, we have the recommendation that has been made by the Committee of Health to elevate this health center to make sure that even the allocation that has been or that will be made in the allocation budget allocation in this facility will be enough to give them enough machineries, enough facilities to make sure that it can cope with the high number of patients that will be attending this health center, Mr. Speaker. And Mr. Speaker, I also wish that this health center is will be issued with the title deed, so that any project that will be done there, Mr. Speaker, we have the insurance that we are keeping our funds in the right place, Mr. Speaker. So we have funding that have been allocated to the Ministry of or the Department of Lands. So I think this is one of the facilities that we need to make sure that it has been given the title deed, Mr. Speaker. So, Mr. Speaker, this facility will really help members who are residing in Rhoda Ward and also in the entire Kaptembwa, which is very highly populated, Mr. Speaker. And Mr. Speaker, when you check even the number of children that are in that area, Mr. Speaker, they have really, they have a very high population in terms of children, Mr. Speaker. And this is a facility that, if at all there is any disease that may lies in that area, Mr. Speaker, it will really help the community in terms of making sure that the patients have got the right service, Mr. Speaker. So I like to support the motion, and this facility be given enough funding to make sure that the facility has been is functional to the limit. Thank you, Mr. Speaker.
Honorable Member for Lakeview Ward, then followed by Malawa West.
Thank you, Mr. Speaker. Mr. Speaker, first, I would want to start by commending the chairperson, Committee on Health, and also the Health Committee because of the many reports that they have delved into and brought into this House. Because, Mr. Speaker, the cardinal role of the members of this Assembly will be oversight, representation, registration. On the part of representation, the members of this committee have done commendable work, going to visit Ground Zero, whereby our patients, our Wanjiko, interact with the people who are hired at the county level. Mr. Speaker, it is overwhelming, and I don't know even what to say when from the first report that we tabled here since I became a member of this Assembly, we have talked about hospitals without title deeds. We have talked about a crucial document that millions and millions of shillings are invested in lands that we don't have title deeds. It is so sad that we have not been able to give even a single paper called a title deed to a facility. This facility, Mr. Speaker, where it's located, it is located in an area that is so highly populated. And as such, Mr. Speaker, we ought to make such facilities better. We leave them in a better state more than we found them within the previous governments that have served. When we request that such a facility be elevated to a level 4 hospital, it will help in ensuring that the problem that we have at PGH are scaled down so that that facility can uptake some people. In the year 2020, Mr. Speaker, you remember the country was hit, and globally, the world was hit by COVID. And we're in short of such facilities. We were in short of good facilities that could have served as well. It is time that the country, not just the county government, but the country, the entire country, takes note of health facilities. Because at one time, Mr. Speaker, I remember, there were no beds across the country. And it was affecting not only the people who are out there, Wanjiko, it was affecting each and every person. There came a time that people had even to buy beds. But today, Mr. Speaker, we're in a situation whereby we are not thinking about such a situation anymore. I would further recommend that at the national level, health be devolved completely, Mr. Speaker, because when you look at Schedule 4, health is a devolved function. But when you have it being curbed and contained in Nairobi, I don't know what we do. When we had the previous cabinet secretary, Nakumicha, I remember, Mr. Speaker, there was outcry of nurses, doctors across, a cry that made some of them even stop and sleep outside Afya House for some time. Yet, Mr. Speaker, we are still not discussing this. We are not discussing such issues. So when I get a committee that is visiting hospital facilities, not one, not two, we have visited Mathare Hospital in Nairobi. We have visited PGH, Naivasha, Bahati. Across this county, Mr. Speaker, it is in order that we give them a commendation, Mr. Speaker, and such are the people who will see heaven because of doing things that were meant to do within this assembly. Mr. Speaker, sir, I stand to support this motion. Thank you.
Thank you, Honorable Speaker. I'm Kuria from Malwa Westward. I raise to support this motion. And Honorable Speaker, also I want to commend the good job by the Health Committee. I'm one of the members, and we have visited various facilities within the county, Honorable Speaker. And this facility, since it was constructed back 2010 to date, it's almost 14 years down the line, Honorable Speaker. And the funny thing, and this thing has been repeating itself, most of our health facilities within the county, we have an issue of title deeds, Honorable Speaker. I don't know what we are going to do, what we are going to make sure that our facilities, because it's my first time in this assembly. I'm going maybe to get back or go home in other areas. But which legacy are we going to leave that most of our facilities, especially the health center, have the title deeds? Right as at now, Honorable Speaker, in this facility, without title deed, when you visit Malewa, because I have 4 facilities, we are going to visit our facility, we will find the same mistake repeating itself, Honorable Speaker. So the Department of Roads should come up with a solution where we are going, or they allocate a certain department that they ensure all our health facilities, Honorable Speaker, have the title deeds, so that we can become the rigid owners of those facilities. One thing I came to like about these facilities, Honorable Speaker, is a department of sector of gender-based GBV violence, where you find most of the residents within the area, and especially in Loda, that area is more densely populated, Honorable Speaker, with a population of more than 18,000 people living there. You find in terms of violence, we have people who are suffering socio-economically. We have the sexual harassment, Honorable Speaker. We have many things that this facility is helping to resolve, so that the resident within that area can live in peace and bring back to life those people who are going against maybe their will or the standard of living. Honorable Speaker, the issue of understaffing, even if that facility has been understaffed, also in the entire county, Honorable Speaker, we find also most of our facilities are being understaffed. Remember, agenda number 1 of the governor was health, matters to do with health. What are we going to do so that we can have, we can eliminate this issue of understaffed members within our facilities, Honorable Speaker? That means we need to sit down with the budget team and enhance the budget allocated on matters to do with health, so that we can employ more staffs, so that the services delivery, and remember, the workload within the facilities is more, depending with the population, such that even the patients who attend that facility will be attended comprehensively, Honorable Speaker. I therefore raise to support this motion, Honorable Speaker, and say thank you to the committee for the good work that we have been doing. Thank you, Honorable Speaker.
Honorable Mercy.
Thank you, Mr. Speaker, for this opportunity. I'd like to take this opportunity also to congratulate the Chair for Health. Out of the committees in this county assembly, I would like to say that the Chair for Health has been working tirelessly and has proven to be outgoing in terms of the understanding of his mandate. Mr. Speaker, if you look at the reports that have been tabled over the past 2 years since we started this session, I think the Committee for Health is leading, and I'd like to give it up to them for that, for they've continued to give us business to undertake as a House. Mr. Speaker, looking at this report for Rwanda Health Center, it is really quite sad to realize that as a county, we still do not take matters of healthcare seriously as it should. We just like to keep on talking, but when it comes to doing the serious business, that is where we draw the line. Mr. Speaker, it's such a shame and it's such a sad afternoon to realize that the Chair for Budget actually stands to support these, but when it comes to the actual work of allocating funds and realizing the real business that needs to be done for healthcare for this county is done, that is where they draw the line. Mr. Speaker, I'd like to inform the Chair while standing here that when health was devolved, it was actually given, counties were given mandate to budget, to plan, and to oversee issues of healthcare in the county, while the national government was also just given the mandate of policy and policy direction issues. So as a county, we still need to stand up and smell the coffee. We cannot just be debating issues like this day in, day out, while when this budget cycle comes, we do not give money to our healthcare. So, Mr. Speaker, it's saddening, because if you look at this report, Mr. Speaker, we only have 10...
Mr. Speaker, point of information.
I don't wish to be informed, Mr. Speaker.
I want to inform the House, Mr. Speaker.
Okay.
You want to inform the
House.
All right, Honourable Member, let's give the Chair a minute.
Thank you, Mr. Speaker. Mr. Speaker, when we touch on matters to do with budget do not originate from this assembly, Mr. Speaker. And I want also to inform the House that whatever changes we do on the budget, on the physical paper that we are given in this House, we do it collectively as a House, Mr. Speaker. It is not the matter of the chairperson, budget and appropriation, but a matter of the entire House. Mr. Speaker, when the budget comes from the cabinet level, this House can only trigger 10% of that budget. You can only change 10% of that budget. Health itself, Mr. Speaker, occupied 38.8% of the entire Nakuru County budget. That is around 8.7 billion Kenyan shillings. Mr. Speaker, I welcome the honorable members to be dealing with the budget appropriately when it comes to the House. Thank you, Mr. Speaker.
Honorable Mercy, can you continue?
Thank you, Mr. Speaker. I hope the House is informed accordingly. But the goodwill comes from the chair budget because it's the link to the between the Assembly and the Executive. So the buck stops with the chair again. He holds the mantle of the Budget Committee. Mr. Speaker, I was just taking the House to page 6. When you look at the staffing of this health facility, we only have 10 nurses, a ratio of 10 nurses to 6,000 people. Mr. Speaker, I don't think this meets the World Health Organization requirement for population versus healthcare staffing. I think we need to do better, while also congratulating the member for this word where Ronda facility stands, because we've seen that he's done some reasonable work. But I'd like to challenge us as a house that as we continue debating on this, we should also continue to champion for health collectively, because we are a devolved unit and we should stand at the front. Thank you, Mr. Speaker.
Let us have the mover to respond.
Mr. Speaker, I would wish to donate 1 minute to a member from Lord Award.
Thank you, Chair. Asante, Mheshimiwa Speaker.
Chair, you are assigning yourself the roles of the chair. Sorry, you had not caught my eye, Honorable Machari. You can go on.
Asante, Mheshimiwa Speaker, kwa nafasi hii ili ya kuweza kuchangia mchango huu, na asante Chair, naona kama Chair wa health aliniona, na nashukuru sana. Mheshimiwa Speaker, nasimama kuunga mkono mswada huu ama ripoti hii, kwa sababu najua hii hospitali ni baadhi ya hospitali zile zinasimamia maeneo hayo, na kuna zaidi ya watu 1,100 karibu 3. So wakati tunapozungumza mambo ya kuipeleka katika level 4 ni jambo la muhimu sana, kwa sababu itasaidia. Kuna magonjwa ambayo hata haistahili kuwa referred ama kuwa referred kule katika hospitali ya medical na katika hospitali zingine kama annex. I think this is one of the hospitals ambazo zinachukua watu maeneo hayo na inasaidia sana. Na hata kama katika masuala ya maternity inastahili kuwa nayo. Na naamini ya kwamba wakati huu ambapo sisi tumepewa nafasi kama wabunge wa 2022-2027, naamini ya kwamba masuala hata ambao tunafaa kuyatilia mkazo na kutilia maanani ni masuala kama haya ya hospitali ambazo tuko nazo, tuzi-equip na tuzifanye hospitali ambazo zitasimamia masuala ambao ni wananchi ambao wanaishi katika area hiyo. Ukienda Kaptembwa pale kuna watu, Mheshimiwa Speaker, kuna wingi wa watu. Kaptembwa peke yake iko na zaidi ya 100,000 households. Hauja hesabu Ronda ambayo imeshikana pamoja nao, iko na karibu 70,000 household. Urudi uhesabu area hizi za Barut na kwingineko kama Kapkures, ambapo wengine wao pia kwa sababu zile dispensary ambazo ziko ngambo ile hazifikii hii ya Ronda. So naungana na ripoti hii ya committee ya health ya kwamba masuala ambayo yanahitajika hapa yanastahili kutilia mkazo na kutilio maanani, na hata kama ni bajeti ambayo inahitajika inastahili ya kwamba iongezwe, so that hospitali kama ile ambayo inashughulikia watu wengi iweze kutilio mkazo na kutilio maanani. Asante Mheshimiwa Speaker.
Chair, you can make your final comment also as you clarify. Is it the Ronda Health Center? Is it in Ronda or Kaptembwa?
Iko katika Kaptembwa, lakini kwa mpaka kabisa.
Thank you, Speaker. That's why I was donating 1 of my minutes that he confirm whether it is in his ward. Because at first when we were there, I wondered why is it called Ronda, but there are a lot of explanations that were made. Mheshimiwa Speaker, allow me to say that it's true, there is budgetary implications as far as the health, human resources concerned, and we need to sit down as a house to look at that matter, and also to shape even the budget of the health department so that it can address those critical issues. Mr. Speaker, we do not need actually to construct any more facilities. We need to equip and operationalize whatever currently we have, so that we can be able to tap services from those facilities that we have. Mr. Speaker, just yesterday we were a certain organization that was claiming that we have mushroomed infrastructures, or other structures have mushroomed in the name of health facilities. Therefore, Mr. Speaker, how I wish that going forward, this House will agree with our committee to address the concerns that we have already raised in these reports, so that we can be able to move forward. Mr. Speaker, on the issue of the title deeds, how I wish that the chairperson of the Lands Committee was in this House, Mr. Speaker, so that they can be able now to give us proper response as for what they are doing as far as these state audits are concerned, so that at least we can save our facility. On the elevation, as one of the members have said, it is timely, it is deserving, and that facility, if only it to be elevated, it will be a source of revenue. And now that, Mr. Speaker, we are having the issues of the chief, and there is a line of referrals that they want to take as a national policy, as it's been said, the guidelines that were given by the national government. People will be starting at level 2. Then they go to level 3, then they'll be referred to the level 4s. And therefore, if this level 4 will have been accredited, it means the people of that region will not be going to PGH, and therefore they are going actually to be getting services near their homes. And therefore, we'll be assured that our people are going to get the proper services, because that will be a rockery solution to their medical concerns. Therefore, Mr. Speaker, I beg to request the members to support and the implementation committee to take on this matter and respond to this House after 6 months. Thank you, Mr. Speaker. I beg to request the House to support.
I now put the question that this House adopts the report of the Committee on Health Services on the visit to Rhonda Health Center in Kaptembwa Ward, held on 24th October 2023. As many as of a similar opinion say aye. As many as of a contrary opinion say nay. The ayes have it. Next order.
Mr. Speaker, sir, those are the orders of evening session.
Members, this House stands adjourned until Tuesday, 9 a.m.